Hello guys, how are you doing? Today we're going to focus on the lower back area. Any discomfort or pain you may feel, whether it is an underlying problem that you are seeing a professional for, or it's something a little less serious than that, could be exercise related, could be backache from sleeping, or perhaps too much working, too much sitting. Whatever it is, what we have today may help you relieve that area. Start off on our backs and just bringing your legs up to the sky. You can choose to swing your legs side to side, like a little massage on the floor, just rolling the back side to side, nice and simple. Sometimes I like to bend my knees and do this at the same time, making sure you're relaxing your head and neck. Next, we're bending the knees down, keeping them around about in line with the heels. Lifting the bum off the floor. You'll notice there's a lower back curl here and the lower back is lifted away from the floor. I want you to come up and down, pressing into your heels, and some of the weight will be falling into the shoulders. Make sure it's not folding into the neck. This will strengthen your glutes, which is often a reason why your lower back has any problems. So please continue up to 10 reps and then build on from that point at a time if 10 is difficult enough. Coming to the next movement here, again having the lower back onto the floor. We're going to keep the knees bent. I want you to notice that when you're laying comfortably and normally on your back, you have this natural curve underneath the back, and you want to learn to flatten that space. You'll notice in the video I am curling my pelvis, which we call a pelvic tilt. It's when we roll the hips down as if we're starting to go back into that bridge pose, the exercise we did before. And it'll flatten the lower back into the ground. You can use your hands to feel if it's flat enough. And I'll repeat here a few times just to show you what it looks like. You'll notice the hips are curling forward and over, not backwards. You can repeat these exercises until you become more aware of what you are doing. And maybe if you feel that you are mastering it and you want to advance, you can always pull your lower belly in and start to hold the exercise. This exercise shouldn't be hindering your breath. Next, we're going to move on to ab work, which is also something that will help any lower back issues. Strengthening the abs and core. I'd like you to keep the knees above the hips and see if you can extend one leg at a time just away from you. Your choice in the beginning on how high you want to keep your legs off the ground. And just repeat for a while, changing up the exercise and being very aware of where your back is. If your lower back starts to lift while you are moving in these ab exercises, it is not good for you. You need to keep your legs a little higher. Make sure that you keep pulling your belly in. You may lose it at some times. I want you to just keep trying to pull it in. Keep reminding yourself to keep the back down, keep the belly in, and keep breathing. I recommend as slow as possible so that you maintain good control. Next, we're going to need a foam roller. I have a long old one here, but you're very welcome to get one of the new ones that are a bit more bumpy and shorter, as long as it fits the length of your body. I want to roll onto my shoulders here, take some weight into my shoulders, tuck them in a little bit more if the weight is falling in your head or neck. You're going to lift up the legs, and just the same as we did in the very beginning of the video, you're going to face the feet to the sky and roll the back side to side, changing positions if you feel you need to. You can linger here for a good 5 minutes if you want. Sometimes this is enough for a lot of people with lower back issues. It's good for the relief. Any pinching that is going on is normal. If you feel any pain, you may want to get out of it sooner. Maybe your lower back doesn't like it today. When you are done, I do want you to do a little stretch forward, whether it be standing or sitting, just rounding that lower back so that you are able to relieve that back for a while, counterbalancing the back bend with a forward bend. Sometimes I like to come into a butterfly by bringing my feet together and just rolling forward as far as I can reach. And that is it. I hope you have a good day and continue to stay safe.